Within social work training, which is degree level at either bachelor's or master's, research is a really prominent factor, and we are encouraged to understand how to use research, how to undertake our own research. However, when people come out into the field, very often they're in statutory roles such as child protection or the kind of very fast-paced mental health environment, which is predominantly health driven. Sometimes they're in generic roles, and people lose the focus. They become bogged down in the task and they forget all of the critical thinking and analysis and ways of using evidence to support people that we learn initially. When I was approached about the possibility of social workers working within Devon Partnership Trust being seconded to a research project, I really did feel that I was being included in the business of the trust, and I knew that if we could field some social workers and use this as a first step, then we could begin to build on this. We could show that actually this has value and this is something that is useful to the organisation and to the people who use the services.
My name's Anna Hayden and I'm a social worker. I work generally in the STEP team, which is the Early Intervention for Psychosis team. And recently I've started doing a research secondment. So what brought me into the secondment was becoming really interested in research and thinking about how I could influence potentially the system within which I work. And that was really about wanting to hear people's voices. So the voices and the knowledge of my colleagues, the voices and the knowledge of my clients. Research sounded like an opportunity to be able to find a way of harnessing that knowledge and those insights and use it to improve the treatment and really improve the experience potentially for people coming into mental health services.
We need to undertake research that is useful. We need to understand how people are, how people be within their own situation. If we only research one aspect of a person, we can't fully understand how things are for them. And social work research and the implementation of the statutory social care duties, now that we have the Care Act, can actually support that.
I'm Caroline Skinner. In my current role, I work as an approved mental health professional based in North Devon in Barnstaple, and I practice manage the daytime North Devon AMP team. I wanted to find out more about the secondment. I viewed it as maybe career development. It's something that I might be interested in moving into, and I thought it gave me an opportunity to explore the world of research and see if it was a good fit for me as well. I don't know if I've ever seen an opportunity for a social worker to be seconded into research. The main challenge was really getting freed from my daytime role. I think social care research is important on a lot of levels. I think at the most obvious level, good quality research informs practice, and I think practice should be evidence-based in social work in the way that it is in health. And I think it's really important as professionals for us to retain a curiosity in our role and to be critically evaluating what we do, why we do it. Is it good? Is it effective? Does it work?
There's a recognition at the moment that social care is an intrinsic part of the system, but there's a fundamental lack of understanding from government level right down to the shop floor about why that is. We need research that understands that people don't want to be patients forever, or they don't want that to be the sole element of their life. So there's all sorts of levels that we can use social care research. We need to bring a parity with medical research. We spend all sorts of money and all sorts of time. We have a research department in our trust, and I believe this is the first piece of social care research that we've undertaken.
So I'm coming to the end of my secondment now. I've really enjoyed it. I've learnt a lot. I think what needs to happen is there needs to be a follow-on pathway for social workers to go to the next stage and go to the next level. Social workers have got heads full of ideas, lots of knowledge. Really, we need the framework and the pathway to be able to work that into intelligent research questions that will really benefit the services that we work within.
I actually learnt quite a lot through this secondment, and I think it has enriched me as a professional and a practitioner. Ideally, I'd like to see social work research more embedded within local authorities and frontline practitioners being more able to participate actively in research. I think it will sustain and promote a research-minded culture that I think is to everyone's benefit.
I'm quite enthused now, and reading the evaluation of this, I've tasked myself since reading that with linking in further with our research department and looking at future ideas for a rolling programme, because if we have the ability to undertake lots of research on the medical side, then surely we must be able to include one a year at the very least, if not more. What I'd like to see next is a recognition across the whole trust that social workers need to maintain their professional practice and standards. They need to do that for themselves, but they also need to do it for our system, because if we are to get the most out of our system, we have to have everybody working to their optimum capacity, skills and knowledge, so that we begin to look at the less medical and the things that really matter and make a difference to people at a point in their lives.